GIRFT, get it right first time. It is the basic national review of adult elective orthopedic surgery in England. Study launched 2012 by Tim Briggs. Uh, Observed some discrepancies, massive variation in infection rate, massive number of surgeries done in total hip and total knee replacement surgeries, large variation in implant and different ODEB ratings, and failure to follow the evidence and registry data in decision making. Recommendations was number one, cemented hip replacement for more than 65 years of age, 10% increase after using this method. Number two, enhanced recovery time, same day admission, small wards, less nurses, reduced length of stay in the hospital, reduced risk of DVT. Number three, fenced orthopedic beds, laminar flow theaters, improved theater discipline, reduce cross infection. Number four, reduce the variation between the practice in the country. Number six, appropriate orthopedic theater staffing. Number six, minimal critical volume.